So we have the good fortune of having Dr. Rajesh Sabapathy doing the opening batting today. So he is known for his T20 skills. So, the rapid fire round starts here. Dr. Rajesh Sabapathy, please.
Thank you. Thank you so much, Sandeep. And I welcome all of you. It's our pleasure to have all of you with us. And when my son asked me that you have to speak in this press conference, I asked him what I should speak. He said, I'll put you on a Sunday morning first talk. I'll put you on, and then he said, you should speak about this. And I asked him how many minutes. He said, 20 minutes you'll give. The title has got three things. One is starting, nurturing, and excelling. It has got three words in it. So first I'll start off stating, where we are, and then where we started, and then how did it all happen. Presently we are an institution of 650 beds. We have about more than 2,600 people working in the organization. The 224 doctors, and we see an outpatient load of 220,000 outpatients a year. And we do about 27,000 surgeries a year. But where did we start? In 1991, when I came back from Louisville and Cannisburn, my brother was also spent 3 years in the UK, and we came back together. We started with a hospital which my father had started. It was 35 beds. It had 4 operation theaters. Both of us and one young Meena, a nice girl, which was the SHO. In the first year, we did about 250 surgeries. In the first year, we thought, magnificent start we thought we had. And our aim was that we should reach sometime, we should reach about 3,000. That was the thought of the day. But it is not a unique growth story. There are a lot of stories like this around the world. And even when I was in medical college, my role model was Mayo. And because I read a small book called Mayo, on Mayo, which I bought it for 1 rupee in Moore Market, the old bookshop. That is about 5 cents. I think that's the best investment in my life ever made. Value for money, 5 cents book, which I read about so many times. Mayo Clinic was founded in 1864 in a very small way, and it's more than 150 years and is growing, still growing and so on. Christian Medical College is the other institution which I greatly respect. It has covered a missionary, started with 1 bed. And now it's a huge institution. That is a model institution. And after we started, Arvind Hospital in Madurai became my role model, another role model. It was founded in 1976, and is one of the largest eye care system in the world. So the first requirement, I would say, I learned from these things is that anything you want to do, you must put your pen to paper. That means you need to write. You need to articulate your thoughts on paper. Otherwise, what will happen is you will keep on thinking, I want to settle, I want to do this and all that. But then if you really try to put your pen to paper, you will find it's extremely difficult. Otherwise, no matter how many talks you listen to like this or how many books you read, nothing tangible will happen. This word, I thought, the title has got 3 things. It starts with the beginning. So there are some people who have just finished. A lot of people ask me during the dinner times about beginning, what I should do and all that. So I thought this morning when I was putting the slides, I thought I'll put some few slides for them. I think it should start even during your training, and planning should start even in that stage. You may not finally end up doing what you planned, but you should be planning. I think that's very important. I think a lot of people, even if you ask everybody who is sitting in the hall, in the front line, who are all the stars, if you ask them, did you ever think that you will be in Netherlands? I think Shan will say, no, I didn't think that way. I think if you ask Dr. Venkat, did you think you will be in Chelmsford, end up in Chelmsford? He will say no. But then they all had, all of them will have some thoughts, some planning they'll do. You must know as to what you'll do after you finish your exam. At least that you should do. Many times I find fellows coming for exam. They say, what will you do after your exam? Sir, I'm thinking after the exam. Then I said, no, till the exam you will be a postgraduate trainee. After that you are an unemployed doctor. So you can't have that. No? So you must have at least something you must do. So 2 things you should think at the time of your post-graduation. One is, where would you like to settle? I think you decide. No matter, it may not end up with that, but I think you must at least know, I like to be here. And what subspecialty you would like to take. Some idea you must have. So where is this, why is this important, or where would you like to settle? For example, we decided that we'll settle in Coimbatore. So I know what Coimbatore needs. Coimbatore is an industrial city. There are a lot of industrial injuries. So hand surgery will be a good bet. So like that, if you think I'm going to settle in Vizag or going to settle in Hyderabad, you know what Hyderabad needs. So if you are able to do that, that means if you are able to prepare that, of course you might not like to settle in a place, but destiny might have different place. That's different. But then at least you must start doing that. Second is, what subspecialty would you like to choose? In this, I think as for all Indians, I would say you should make this choice with your heart than with your brain. Because in India, always people tell me that I like to choose where there is prospects. Oh my God, this word really bores me, in the sense, in India there is so much of need in everything, so there is scope for everything. The needs are so huge, so if you must be good in it. I think that's what it means. So if you are choosing a subspecialty where you love, that means you will do well. Automatically you will win, and your attitude matters most. Then you should choose the level of your playing field. So you may like to do aesthetic surgery or breast surgery or hand surgery. I worked with Dr. Sarat Chandra, my general surgery teacher. He said, you could make your life by doing inguinal hernia, hydrocele appendicectomy, like that. Or you could become one who, in addition to doing all that, would be managing an obese diabetic patient with obstructive jaundice due to a CBD gallstone with impending hepatorenal syndrome. So that means if you have to do this, in addition to your surgical skills, you must know a lot of physiology, you must be creating a setup which could do that. You should be collaborate with a lot of people. You know the timing in which you operate. So that becomes different. Both options are okay. Not necessarily everyone has to do this CBD gallstone in a jaundice patient. Okay, but you have to make a choice. But you may have to make a very conscious choice. You have a full liberty to make the choice. But you cannot escape the consequences of making the choice. So you decide that you do inguinal hernia, you like to work for like a fellow with inguinal hernia only. Because then you cannot be seeing a fellow who is doing big and then, oh my God, he is doing that, I am not doing this. So difference in the two situations is that the preparations are very different and rewards are very different. So how will it apply to our plastic surgery? That's one. So I leave out the fellow who was doing inguinal hernia, but that doesn't really require a great deal of effort. Flying solo, then whether you want to fly solo or you want to be in a team, skilling yourself becomes very important. So when you're choosing the second option, I personally feel you must work under someone who is far better than you, at least till you reach 35 or 5 to 6 years after you qualify. That's very important, because if you just start off alone without this thing. So we qualified in 85 with Professor Venkateswaran. We had a good training, 85. But then 1985, we started our practice in 1991. So that means 6 years of working with people, So there you must learn both the hard skills and the soft skills you must learn. Second is, don't try to brand yourself too soon into specialty. I asked a lot of people they told me, I just finished here, I want to do aesthetic surgery only. So the initial years, the problem is you may not get there. So I would advise that everybody must be a plastic surgeon with a special interest in hand surgery, with a special interest in surgery, or with a special interest in cleft and craniofacial surgery. You must do everything. I think you must do everything. Even Arvind hospitals, they are head of a glaucoma clinic or a corneal clinic. All of them start doing cataracts in the morning for 1 hour. So they just don't do. Because the skills that are required, even in aesthetic surgery, taking a bone graft. That means, if you're doing trauma, you'll take a lot of bone grafts. So you'll take a nice bone graft. So if you just say, I'll only do aesthetic surgery, the chances of a number of times you take a bone graft will be very less. So initial years is very important, you must be operating. If you specialize too soon, then what might happen is that the numbers will become very less. The worst thing that can happen is that you will dilute your indications for surgery. Because you're not operating, you like to operate. So you'll dilute your indications for surgery, that's one. Or you might offer complex procedures when simpler options may be better. So I personally feel an ideal surgeon is more dangerous than a very busy surgeon. You are a very busy surgeon, you will not really do unnecessary operations. A busy surgeon will not do unnecessary operations. I think that's very important. So flying solo, I don't think in future flying solo will be possible. I think you have to create a team. You can start a solo, but then you have to create a team, just as we all did. Now we all started solo. In a smaller place, you may start alone, but to grow and sustain, because you are thinking nurturing, excelling, then that means you need to you must form a team very soon. So now it come to the next stage, nurturing. I just looked into the Google dictionary and said what exactly this word nurturing means. Protect something while growing. Okay, so how do you grow? So Professor Venkateswamy asked me to write a chapter on organization of microsurgical service, and I put this graph as to thinking how every microsurgeon grows. So that's one side is on the growth, other is the time. Initially, your growth is slow. That means you work really, really hard, and suddenly people recognize you, just take off. So in the first phase, your skill levels, your hard work, your this thing matters. And in the next phase, you just shoot off. And there, I meet a lot of people here. People who have finished a fellowship with us or somebody, and then 5 years down the line, they do a lot of free flaps, a lot of this thing. They buy a new car, new house, everything is there. And people think, oh, I reached, okay? I'm so happy, I just reached. I find a lot of people over there. You just meet them in the conference, they said, so life is very good, sir. Okay, I said, okay, that's excellent. Okay, life is very good. And then this life is very good, goes on till about 45 to 50 years, and then what happens, it goes to phase 3, because you also get old, it becomes a plateau. And whether it goes up or down after 50 depends upon what you do at the point I put X. That's where, so when you're doing very good, then at that time you must start a nurture a team. See, and you have to choose members who are good, if possible even better than you. You need to create a team when you think you don't need a team. Good people join when things are on the move, and young people think you can mentor them. You can have a firepower behind them and build them up. If you try to create a team when you're 65 or when you're tired, I think you will be left with the leftovers. So you will not get the right big fellows. You will not get. So you would read a lot of things. You read a lot of management books. In a team leader in a private setup, I think if you want to create a team, you have to work very, very hard. You have to work very hard. He said he compares it to a street dog. If you have a German Shepherd, you'll get your food, everything you'll get, your time, everything. You have got a place to stay, you have a place to sleep, everything. But you have a street dog, that means you have to hunt everywhere. You have to go around. But you have got a liberty of running around. But German Shepherd is only in a cage inside the house. Okay, so if you have to be an entrepreneur, that means you are a street dog. Okay, you run. So I told you, if you are an entrepreneur, you have to work very hard till you get a team. But after you create a team, after you become a team leader, what you have to do, you have to work very, very, very hard. I think that's what. If you think, if you become a team leader, you think, a lot of people ask me, Ashish asked me yesterday, do you come to hospital, do you operate? He asked me yesterday. Oh my God, I thought. Yeah, Ashish asked me. No, I said, I come along with everybody at 7:30 and one of the last fellows to leave the hospital. It's almost akin to Harry Bunky, he said, when he was closer to retirement. I always thought it was going to get easier, but it never does. Not that he told this in the beginning. I think towards the end of his career, he told this. This is one of the slides which was sent to me from China. One of the American fellows who had come sent this because she was speaking in China about our hospital. And it seems she put this slide. The fellow had taken this and said, what she had taken was, she had taken a shoe rack. These 2 shoes are mine and Hari. He said, if you aspire to lead, be present. And she had put 10:06 p.m. He said, one of the reasons for this place growth is the top fellows are working very hard. Choosing team members is, in India, the real problem was, I think India didn't really grow up in the last generation because people were afraid of competition. A good plastician will have an idiot as his assistant. I think that was the usual thing. The fear of competition was there. That is the problem. So suppose what we really have to do is that you need to have a very smart fellow as your assistant. I really love smart people to be around me because they give you the fire, they give you the energy, they give you the enthusiasm, and I give them the experience. I think I get the better of the bargain. So that's the. So if you are willing to keep working, you will never lose out. Harold Klein said, when you are choosing your partners, he said, if I am choosing a fellow, I don't mind a monkey. But then if I am choosing a partner, I really want somebody who is acceptable to everybody. He must be acceptable to the nurses, to the physios, to the administration. He is acceptable. William Mayo, I think what the words of William Mayo was that, young people give me the energy and the enthusiasm. I give them my experience, and then I get the better of the bargain. So retaining good people is that you need to give provisions for a vertical growth. Initially, I think it's money, then recognition locally and among peers. And they have to be growing up in the academic community. I think in every team, you can't be thinking, no, if I had been outside, what would I have gone? Okay, you never know, no, you might have soared or you must have failed. So life is a package. I think it's just a package, So if you are working in Mayo Clinic, it's a package. Okay, if you're working in Ganga, it's a package. So you have to accept that package and go. So that's if you're starting alone. If you're joining an established team, you need to understand the principles of the founder, ethos of the institution. Please check if they are aligned to your thoughts. If not, don't join. So after joining, don't crib. That is very important. Okay, once you join the team, be a good contributing partner. Okay, I put that contributing big italics. I think I should have put different color also. Okay, you must be a good contributing partner. So what you should do is do what is needed and what you like to do. That's very important. So then you'll be, if you are doing what is needed, you'll be working outside your comfort zone, then you'll be acceptable to all in the team. So a top surgeon is like a fighter pilot. So suppose if you're a pilot, not that you alone can fly. Suppose we had one of the staff college principals talking to us, the air marshal was talking to us. He said, if a fighter pilot has to take at 5 o'clock, the mechanic has to come and inspect it at 4 o'clock. That means he has to leave the house at 3:30. That means he has to take his bath at 2:30. One fellow has to put the hot water at 2 o'clock. So that he says the fighter pilot taking off depends on the fellow switching off the heater at 2 o'clock. So it is not that it's the fighter pilot just flies. I think all of us surgeons shouldn't think that we are doing everything ourselves. Every bit of the team is very important. The next is, you must take up responsibility. You don't tell me I came every day at 8 o'clock, I went at 6 o'clock. You're supposed to come like that way. So responsibilities are taken. You need to take ownership of the problem. See, you must take a solution provider than just telling a problem pointer. So who becomes valuable? I think all of us know the problem. But in fact, you will find the top fellow knows every problem in the hospital. You think you will be inventing problems and telling him. No, the top fellow knows the problems much better because he is seeing from a higher level. So he can see more. Okay, so but then what he is really looking for is to provide people with solution providers. And you can be a leader at any level. See, all don't have to be leaders. All of them don't have to be chairman. Okay, so because all can't be chairman. You can only be one chairman. Okay, but then you can be a custodian of the values of the unit at any level. You can have a top leader in a nurse. You can have a top leader in a physiotherapist. So what you have to do is that you be a custodian of the values of the unit. A potential Waterloo as you grow is thinking that you are invaluable. I think you are indispensable. I think Professor Venkateswamy taught to me when I was a student. He said, individuals make institutions, but institution is always bigger than the individual. I think that's very, 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 very important. You never think you are bigger than the institution. So Venkateswamy told it in a very nice words, easy words. And this is a corporate word, A person's corporate success often comes from the power of the chair he sits in. He often underestimates how much he is an extension of that artifact. So when that person steps out, the world repositions him without his knowing. So it's a big word, But the same thing, what it really meant was that simple words. Professor told me that. See, this applies both to the leader and the member. This applies to both to me and my people who are with me. So I think all of us have to realize this event. The last thing is, excelling, that means becoming exceptionally good. That means you need to have 4 things, I think. If you have a goal, you become a good fellow. But then if you become exceptional, that means you need to have a purpose. I'll tell you what the purpose means, And next is working to a full potential. I think there are 4 things I'll tell them. So if you need to move from good to great, I think if you have a good surgeon to a great surgeon, that means you need to articulate a good purpose and chase it no matter what. Okay, you want to do replans no matter what, whether they pay, don't pay, anything, you just have to do it. But you must not confuse goal and a purpose. Goal means it related to you, saying that I want to be a top class breast surgeon. Okay, I want to do a DF flap in 45 minutes. Okay, that means that's what they are all goals. But then if you say that I want to see that every woman in this area get the best of the breast surgical services they require, that means that's a purpose. That means it is beyond you. That means you need a lot of awareness. How do you make it affordable? How do you make it accessible? How do you are able to provide that service? So purpose is something which is beyond you. So at Arvind Hospital they had a purpose of preventing needless blindness. So we took it up saying, so but trauma means you should think preventing needless death due to trauma. That means it's not. I'm not. If I say I have to become a great trauma surgeon, that's the goal. But you will achieve this goal in the process of this thing. You will achieve that goal. I think that's very important. If you have a greater purpose. Next is where you have to work to your full potential. That means more than what is expected of you. That means you need to work with passion. All of us tell what passion is. So much definitions are giving passion. Oh, very interested, working with either. But this is the real thing is passion is this. Willing to suffer for something you love. I think that's the word, that's the, so that means, you really love to do that. That means you are able to do that. That means you can build anywhere, you can build institution. You can build institution out of a desert. If you can do that day in and day out, I think you will excel in your practice. Third is leveraging your power. You never hesitate to help others. So first is to make the lives of people around you better. That's the only way to become more powerful. I think all of us like to be powerful, so that's only. So Bill Gates he said, leaders in the next generation will be those who help others to grow. I think that's very important. The leaders in the generation. So, so what is really important is that you need to teach, you need to train, you need to help others. Not help others means not necessarily surgeons. You help your nurses, you help your physiotherapists, you help everybody around you. Then it also means taking administrative responsibility. We always say, oh, I'll be a surgeon, I'll only operate. If you just say, I'll only operate, you will not operate. Because somebody else will not, they will not let you operate. So it's not becoming means president of the professional organization, you're not becoming an APSI, president of BRASCON like that. It starts with eagerly and effectively participating in local committees. Bruce Bailey used to tell me when he was there, committee meetings will come, all other consultants will say, oh my God, Bruce, you go, I don't like to sit in the committee. So that's the reason we lost the game. So you need to be sitting in the committee at that time. This is a nice word. If you are not at the table, you'll end up being in the menu. Okay, so that's very important. So if you don't work up, okay, if you don't meet with the administrators, if you are not willing to do this, that means then later on they'll eat you up. The last one is you must move from the concept of entitlement. So as you grow, you will start thinking, oh, I work for 20 years, so I'm all right. I work better privileges. Our administration must give me 5 theatres, all that, So ideally, you must feel the best is yet to come. The period of entitlement is getting shorter. It's just like you're having cricket players. He may be Rohit Kohli may be a big guy. You just score one season, it doesn't go, then they also is a spent force. So in film actors, if they don't give 2 good movies, gone. Whereas in surgeons, we don't think that way. I think you're only as good as the last operation you did. You are only as good as the last dance. Okay, similarly, you have to think, you have to continuously be doing that. So everything is within you. So as Vivekananda said, everything is within you. You are the maker of your own destiny. Life is a matter of making choices. I will again tell this word for all the young people. You have the liberty of making choices of what you want to do, how hard you like to work, with whom you like to work. All that you have the choice. Not that destiny has the choice. You have the choice. But always remember that you have to face the consequences of making the choices. I think that's too much. I think you need to sit down, think, take a paper, write, okay? And be happy to do that and enjoy the journey. Thank you so much.